Hello, I'm Dr. Greg Maguire. I've been asked to give an update on the coronavirus, COVID-19, that is now spreading through the US. Part of what's going on is that we've been ill prepared for the pandemic, which we knew was going to spread to the US eventually. And months ago, we should have been preparing be able to test and quarantine and treat people effectively for this deadly disease so that the virus spreads easily. So if we compare COVID-19 to influenza, for example, the COVID-19 spreads at a rate, these are data from China, so they may be slightly skewed, but it may be a rate 2 to 5 times higher than influenza. So significantly more spreading of COVID-19 than we have with the influenza virus. Now, in terms of death rates from COVID-19, again, the early data from China suggest about a 2% rate of death. So if 100 people are infected, 2 people will die. And that rate of death from COVID-19 is probably on the order of 10 to 20 times greater than the death rate with influenza. And the deaths have been occurring, at least in China, people from about 35 to 80 years of age, younger people, haven't been so affected by this disease. So it's about 80% of the patients in China that were tested positive for COVID-19 did not require hospitalization, but of course that means 20% did. And again, 2% of those that were infected with COVID-19 died. So what is it we can do to mitigate the spread of this deadly disease? And if we do find ourselves infected, what is it we can do to better fight the infection? First, to stop the spread of COVID-19, it's best to wash your hands often. So first of all, if you're out and about and you see someone expressing symptoms of influenza or COVID-19, such as coughing, sneezing, wheezing, not able to breathe properly, avoid those people. If you're out in a public place, touching surfaces with your hands, before you touch your mouth, your nose, your eyes, make sure you thoroughly wash your hands. So these viruses can lay on surfaces and remain active for hours, even days. And if you touch that surface and that virus is still active, and then you touch your mouth, your nose, your eyes, you can potentially contract the disease. There are a lot of people out there wearing surgical masks, trying to prevent the virus from affecting their respiratory system. That doesn't work, or at least it doesn't work well. Those masks do not filter the COVID-19 virus particles. What does, at a rate of 95% efficacy, are the N95 masks. So those masks work pretty well, but only if they're fitted well to the face. So if you're going to rely on that to stop COVID-19 infection, it's got to be a well-fitted N95 mask. So again, avoiding those with the respiratory symptoms, avoid putting your hands into your mouth, your nose, your eyes, wash your hands frequently, staying away from places where there's a lot of people who are traveling back and forth to those areas that have high infection rates, such as mainland China. Iran and northern Italy would be good advice. And if you do find yourself infected with a virus, whether it's influenza or COVID-19, one of the things that really helps to quell the disease as best you can is eating a very plant plant-based diet. So mostly, if not all, plants, rich in vegetables, brightly colored vegetables, lots of greens, including grains. Now they have to be whole grains. It's like whole wheat, whole oats, beans. They present to you both soluble and insoluble fiber. So what the soluble fiber does, it will be fermented in the large intestine and the colon, and it will produce molecules that help to upregulate both your innate and your adaptive immune system. Your T cells, for example, will be upregulated and better able to fight the disease. Now, this is from peer-reviewed, really good publications that I'm citing these data, so that they will fight the disease better if you're eating these vegetables with fiber. The insoluble fiber will actually help with something called mechanical autophagy. So as this fiber transits through the intestine, it causes mechanical movement of certain protruding cellular components that then turn on what we call autophagy, and that's a clearing of infectious agents. So you'll induce that, but you'll really reset the immune system such that it better fights the infection. But equally important, part of the damage to your tissue is through the immune cells releasing a lot of damaging molecules. And if you eat the vegetables and the fibers, your system is better able to quell the inflammatory state that the immune system has induced. So you want to fight the infection, but also be able to quell, bring down that inflammation, which causes self-destruction of your cells. The other thing the plants do for you is to bring you a wide variety of antioxidants. So the plants bring all kinds of different antioxidants, setting up the antioxidant cascade. And again, good peer-reviewed publication over many years has shown that if you use antioxidants from a natural state, i.e. plants, they're going to fight these viral infections. This is unlike overdosing on a lot of vitamin C supplements where you bring in only one antioxidant at high levels, which will actually become a pro-oxidant, cause your body not to produce its own antioxidants or use other antioxidants effectively. And so instead of supplementing with one high level antioxidant like vitamin C, what you want to be doing is eating a lot of fruits and vegetables with some supplementation. Minor supplementation is fine. So this is my latest update on coronavirus COVID-19, and I will bring more to you later as we know more. Thank you.